Why would somebody go to a doctor on Zoom as opposed to in person? What are the features and benefits of a virtual practice?
Telemed has been the word, which I hate the word.
Since COVID, right?
Since COVID.
Mm-hmm.
I guess it was around beforehand.
Mm-hmm.
I mean, I had an online digital presence and a community for my practice way before COVID.
Yeah.
You know, there was reasons, but I had reasons for that. So, but we're seeing it more and more. So how is it, the market's changed quite a bit to the point where you're going to your doctors online. I wonder what's good about that. I wonder what's bad about that.
So there's good and bad, or features and benefits certainly to an in-person experience as well as a virtual experience in both the natural delivery of healthcare as well as the pharmaceutical or medical delivery of healthcare.
Right. So from our perspective, because we both work with clients online.
Yeah.
So, and I find it to be an incredible experience, but I'm certainly not doing my chiropractic practice as it was online, right?
Mm-hmm.
So there's a difference. Can't deliver an adjustment online.
It's hard to reach through the screen.
Yeah. So there's elements of my practice or elements of my service that I work with people that are digitally, and I find it to be incredibly beneficial for my patients. I find it to be incredibly rewarding as well. But I also see a lot of people going for their regular medical visits, almost like you can pick the right doctor to get the right treatment, and it's almost marketed that way.
Yeah.
So you've got, whether it's hormone replacement therapy, so there's people that are choosing to seek out or look into something. They find the right doctor, they start going under that care, right? So it's not like you went to your general practitioner who was having a conversation with you, taking an intake, finding out a lot about you, your lifestyle, what's going on with you, and then prescribing some sort of care. This is more, I find, that your people are picking and choosing from finding information or hearing from other people what they might want to get into, and then seeking out doctors that provide that care. And I wonder what you think about that, because it's kind of putting a lot of the onus on the patient and what they want and I wonder how well that is as far as the diagnostic is concerned, because they're basically looking to get some sort of care based on some symptoms in that particular case. So I wonder how well that's working out. And then there's other things that I think work really well in digitally and online.
I practiced for 23 years in Manhattan, in New York City, and I always had a specialty. Right after I graduated from chiropractic college, I got into a 3-year postgraduate neurology program and started to specialize in brain-based challenges that people were having. Everything from early childhood development to early Parkinson's and Alzheimer's and stroke, and then kind of everything in between. And I kind of settled later in that process on sports concussion. So I kind of had this unique approach. And then when you work with brain-based challenges, you cannot ignore metabolic health. So I started to really get into blood chemistry to a level that really allowed me to have a very unique practice. Chiropractic,
let's pause there a second,
nervous system.
But so you're working on brain-based injury care, and you say that it naturally filters into metabolic issues. How does that work out for someone that might not understand the bridge?
Yeah, so even in the most basic level, so one of the things we can do is, give a concussion to a mouse and see what happens after the concussion, and immediately the gut becomes the issue. And doctors' emergency rooms have always known this, that if you have a motor vehicle accident, there's a severe head injury, there's all kinds of hydrochloric acid being dumped into the stomach. Like, the brain-gut connection has been well understood in an emergency setting, certainly for a long time. So when people have brain-based challenges, so for example, one of the first signs of neurodegeneration associated with Parkinson's disease is gastrointestinal, right? It's constipation. So there's a brain gut connection there. And then if your gut is not working well, then everything that's floating through your bloodstream is not optimized. So that was kind of why I, fell into this, again, out of my own interest in working with patients. So I developed a reputation. I've always been asked to speak around the country to groups of chiropractors. And chiropractors are amazing at what they do as far as understanding the relationship, the structural relationship between the spine and the nervous system. And they go to school and they become great at delivering the removal of interference at the level of the spine, and it's usually structural. But they also, the ones who knew me, would refer me their patients that it was just so obvious they were having metabolic challenges too. So early on in 2010, 11, and 12, I was getting tons of referrals from people who are under chiropractic care, and the referral was coming from the chiropractor, and we would co-manage the case, and I would do so virtually. So I was doing virtual work for the last 15 years. So when COVID hit, I would say 60% of my practice was virtual anyway, before COVID. And then I managed to bring it to 100%. But all of my patients are still under care because they're usually referred to me by a chiropractor, or I refer them to a chiropractor. So I do need my patients to have a physical exam. I do need my patients to have an in-office experience. It just doesn't have to be with me.
Right.
So I've been using and leveraging the virtual world for a very long time. Post-COVID, and now with technology, it gets more exciting because we have all this video, ability to work on video, and we have all kinds of online technology where people can submit their paperwork and their intake and their history, and just everything is a lot easier.
And people have gotten comfortable because of COVID to be online, which is another thing, because I remember when I first I had my digital element of my practice, which was more of out of necessity. I knew I was leaving practice because I had chronic pain. I can only physically work 2 days a week and had to recover the other 2 days. So I would see 80 to 90 people. I would adjust them on Tuesdays and Thursdays. So I would see almost 100 people a day, almost 200 patients a week just doing that. But if they were only coming in twice a week, in my mind, I'm like, well, how could I create a better experience for my patients? And it was always about removing the subluxation from the nervous system through the chiropractic adjustment. And then talking about the lifestyle, I always believe with their chemical, physical, and emotional stresses, all the time when they left the table till they came back, what they did with their body, what they ate, what they think, how they use their, how they use their body, was such an important element. I've realized that most chronic issues had to do with chronic lifestyle stuff. So I started to go digital on that, because to take someone in the back and show them a stretch every time, when I can shoot the video for your stretch, send it to you through Facebook Messenger, and then put it in the community, the closed group that we had for the practice, so everyone could see it. I started to create libraries of videos on my stretches and mobility work. I started to create libraries of videos on nutrition, and I created libraries of videos on how to manage anxiety and stress. And here I was starting to educate my patients, was one of the definitions of doctor's teacher anyway, right? So I had the two different things where I would adjust in the office, but I was in your back pocket in your phone 7 days a week if you needed me, and they can connect me through. So my practice became a hybrid. I would adjust on Tuesdays and Thursdays, but I was in your back pocket 7 days a week. If you ever had a question, we could hop on FaceTime, and that's how I served my patients. And then COVID hit. And it was such a blessing, because here I had my patients who I loved, 25 years of practice, and they were scared, and they were home, and we would meet on Wednesday night, and we'd have open office conversations about anxiety and stress, and talk about concerns about the virus and what to do next. And man, if I hadn't done that for the years before and had 300 people in a community on Facebook, I don't think I would have gone through COVID, let alone the ability to serve those people on such a level, and let them know I was still there on Tuesday and Thursday to get their adjustments, and for the ones that would come in and are essential employee, and that all the people. So for me, digital became a very natural extension of my practice. And what we do now is, if I didn't start that now, I wouldn't be able to serve people like I do, because I don't have a physical practice anymore. I only go in part-time somewhere else. But my people that I do manage are going to chiropractors all over the world.
Yeah.
And I get to communicate with their chiropractors, see their scans, and see what's going on in their nervous system while I'm managing them on a
Yeah,
digital
there was a
practice.
point in 2019 where 50% of my practice were referrals from other chiropractors, and it truly is a blessing for them too, because again, 99% of our profession are people who really learn a skill on what to do with their hands. And it's funny, for me to not put my hands on people was very difficult because I'm really good at it. And, you know, I provide adjustments to friends and family. And in the office, sometimes people would ask, you know, all these questions about lifestyle. But, you know, the next patient is waiting and they need my hands. And there's a certain cadence to a busy chiropractor. If you've ever been to a chiropractic office that's busy, the busier the doctor is, the more in the zone they're in. You're getting a better service. When your chiropractor goes from adjustment to adjustment to adjustment, they're giving you the best that they have. So when they would refer these metabolic cases to me, they're like, thank God I don't have to sit and talk to them about, again, not that they don't want to talk, but that's not what they get paid for, to sit and talk about diet and lifestyle and sleep and stress and all of those things. So they were getting that experience with me virtual, and we're looking at their blood work and we're making metabolic changes. So that way they can deliver what they deliver the best. And now the patient's getting great co-managed healthcare. So on the virtual side, I strongly suggest doctors, chiropractors who are passionate about making lifestyle change, because they, you know, most chiropractors practice what they preach and they want to share their experience with their patients. But if you're sitting there having a 20-minute conversation and somebody's in the waiting room like, come on, doc, you know, I just got off of work, I'm hungry, I want to get home for dinner, I'm here for my adjustment, you're yapping about diet with this other patient before me and you're making me wait. That's not good delivery of healthcare. So I found that using the time in the office to deliver the goods was what people were paying for. And then if they were going to work with me on everything metabolic, you know, related to their blood work or their exercises or whatever, that would happen virtually. It would never be in the same space. It would happen virtually. So that way there's a distinction and you know, this is the service that I'm paying for. It's completely different and it's in a different place. You could be at your office. You could be, you know, on your lunch hour. You could be at home. It could be in the evening. It could be in the morning. You're not jumping into your car, driving and getting somewhere. So there's a lot of benefit to the virtual practice for the patient and for the doctor. So that's kind of what I want to get into a little bit here. And
I want to point this out. Like, one of the driving forces behind me doing the digital virtual stuff just made my life easier.
yeah,
Because if you needed me, and I needed to show you how to stretch out your hip flexor, I would literally walk you to the back where I had a little gym area and showed you, get on a knee and show you how to stretch out your psoas. Now what I would do is say, great, I don't have a psoas stretch video yet. So I would shoot that video that night.
right.
Send it to that patient, and then add it to my library. And I never had to show that stretch again. So I became very efficient. I had a library of every mobility stretch video, how to use a foam roller. Every time I had a reason to do one, I did it one more time, and I shot on video. And then I can send. So when you came in my office, and you needed the hip flexor video that I shot 3 weeks ago for John, right? Great. I would tell the front desk, Steve needs a hip flexor video tonight. So when I left my office, I was just going in Messenger and cutting and pasting. Everything in our Messenger chat would be the things I wanted you to do. Anything that was going on in the community was for everyone to know. And I started to have this a way to serve people on a much higher level without having to be so repetitive, and I could focus on the more important things. And when new problems came up, which were more unique, then you can start, then your content just got better and better and better, and you never lost anything. So I think it's a very important thing to do. And then you can always go back and say, I could have done that video better. Now you're tweaking it and making it a better experience for people. But I think there's a lot that you need to do as a chiropractor. Obviously, there's hands-on work, and then there's a lot that we do that's not hands-on work that you can delegate digitally to a community of some sort where you can serve your patients on a higher level, or what we did. So, and then now, that's all I do, right? I'm in an office where I see someone else's patients. I help people on the computer doing that consultation work, and those people are seeing chiropractors.
Right.
Had that happen this week. And what's cool about chiropractic now is, like we practiced, it's easier now because there's so much objective data out there.
Right.
We came up in an L where we use EMG, thermography, heart rate variability to measure spine and subluxation as well as X-rays, MRIs, the blood work that you do, right? So if we have that data, we can help people. It's not really a problem. They can go to other chiropractors, and they're doing the same scans.
Mm-hmm.
And I think now more than ever, we can kind of standardize the care and have open conversations about what's happening in an office for a patient on the chiropractic level, and then we can also serve them on all those lifestyle
and
things.
the technology, with remote patient monitoring, whether it be a CGM, right, a continuous glucose monitor that people are wearing, you can monitor that data, their sleep wearables, right, and that data can come right into us. So we're really using more in the virtual world. We have more access to benchmarks of function than we ever had before. So, all right, so there's technology, there's ease of transferring data, there's using that data to monitor, patient progress, and there's data available to give a lifestyle recommendation or prescription to help them with their particular health issues or goals.
So what does that look like? So for people that are listening to this who maybe they go to a chiropractor, they get their adjustments, they love their chiropractor, and that's what their chiropractor does. But then they come across someone like yourself who's literally, I would say you are the number one person when it comes to functional medicine, reading blood work, teaching doctors how to do it.
Mm-hmm.
So if patients who are going to their chiropractor and having a wonderful chiropractic experience, they also have the ability to be served by you at the same time and really look at those. So now you've got a great chiropractor giving you a great adjustment. Now you have somebody who's managing your blood work, your VO2 max, heart rate variability. Yep. We're looking at and there's metrics involved. So we can consult people through those metrics because we don't need to be hands-on with that.
Correct.
And so they can get top-tier lifestyle care at the same time going to their chiropractor and getting great chiropractic care.
Yeah, so on the virtual side, acute medical care, when there's a crisis, requires you to go to an appointment to have a physical exam, et cetera. Chronic issues associated with lifestyle really lends to what we're talking about here. So that's always been our purview anyway. So what I find to be incredibly valuable is the fact that the basic laws of economics is the busier, the less available a product is, the more expensive it gets.
Supply and demand.
Supply and demand. And, I can have, if I'm working one-on-one with someone, my time is very valuable and I'm expensive to work with you one-on-one. And if 80% of what I'm going to say is what I say to almost anyone, why should that be one-on-one?
Right.
Right? It could be one on hundreds. And now the price can drop because now you're increasing the supply. So leveraging technology where people, instead of, if they want to hire me, they're going to spend thousands of dollars. Well, I can work with 30 people at the same time and they can spend hundreds of dollars. It democratizes the experience. They get the benefit of my experience and my knowledge and what makes me very, very unique. So the virtual side of things not only makes it possible for us to provide a great level of healthcare, probably better than what it was in 2012 when we were just in the office. And when I say democratize, meaning making it available, it now can be a lot cheaper, right? So the virtual experience, I think, is here to stay. I remember back in, before the pandemic, if you were an overweight, underactive, 35-year-old, newlywed with a couple of small kids, and on your spare time, you drank a lot of beer and ate a lot of buffalo wings, and you were probably 25, 30 pounds overweight, pre-diabetic. And, a doctor says to you, look, you're pre-diabetic, you should make some lifestyle change. They're like, yeah, what? I'm going to live, I'll live till I'm 80 instead of 85. Like you can make that calculation, like I'll worry about it later kind of a thing. Then the pandemic hits, and that 35-year-old can be dead in a week because they're so metabolically unhealthy. So it was very, March of 2020, by the end of April, we knew exactly who was succumbing to this virus. It was metabolically unhealthy people or the very old who are metabolically unhealthy. But metabolic health was first and foremost. So now that 35-year-old is like, shit, I could be dead from a virus in a week. So now they're like, doc, what can I do for my immune system? What can I do for my metabolic health? So it brought metabolic health to the forefront and incentivized people to do something about it. But now they can't really go to an office, and there's all these restrictions and masks and all this stuff. So the virtual experience took off. And the work that I was doing, again, if we look at a diagnostic test, the diagnostic test is only as valuable as the information interpreted by the practitioner. So if an orthopedist takes an x-ray of the spine, if there's no fracture, dislocation, or tumor to identify, they're like, all right, well, there's nothing surgical here. Here's some medication for your pain. Take that very same x-ray and give it to a chiropractor, and they're looking at it in a completely different way. Now, the chiropractor is responsible to identify the fracture, the dislocation, and the tumor, just like any other doctor is. We're licensed and educated to do so. But we're going to glean some different structural information about that x-ray.
First of all, most of them would probably take an x-ray in a standing position to identify weight bearing, because that's a function.
As opposed to laying down on the table.
So even the way we take the x-rays,
correct,
we're looking for the same things as far as clinical perspective.
Right.
From health and disease perspective, but we're just checking, looking for standing. We want to see how that x-ray is
asymmetries
standing,
and
the spine
loss of curves.
Is there rotation? So
right,
we're always looking a little deeper than our counterparts on the
right,
medical end.
Well, I saw value in that with blood work too. I am not interested in being a hematologist. I'm interested in being a chiropractor. And a chiropractor's job is to remove interference with the optimal expression of health, and I'm going to use assessments to do that. There's physical assessments, like just feeling the spine and seeing where there's these problems, looking at an x-ray, but looking at blood work and identifying on blood work where there could be interferences with the optimal expression of health. So yes, from a medical legal standpoint, I'm responsible. If I see leukemia, I have to identify it. If I see pathology, I have to identify it and make an appropriate referral. But if I see a metabolic issue that's lifestyle based, well, then I'm reading that blood chemistry in a different way than my medical counterparts. And therefore, that's a service that I said is not being offered to these all the chiropractors have these metabolically unhealthy people walking into their office. They're taking care of their structural needs, but they're metabolically unhealthy.
And they don't have the bandwidth either. I remember being in 5-day-a-week practice, 4-day-a-week practice, and having the heart and mind to help and give advice from the table, and almost like as they're yelling out the door and like, don't do that.
Right.
But like we want to do it all, but you couldn't.
You can't.
So that's why for me, virtual,
and you'll never get paid enough. You'll never get paid enough.
Was
for that.
born from that because we wanted to serve on a higher level. We knew we had to compartmentalize it,
Right.
And when they're getting that adjustment on the table, which is such a unique experience to chiropractic,
hands-on, spiritual, emotional, physical experience that should not be interfered with while they're on the table, having that healing experience, having a conversation about what did you eat this morning.
Yet, how do you get it all in, right?
Yeah.
And and you said it yourself, blood work. I use heart rate variability. So there's ways, metrics that you can do. You don't have to be there to get those results and have an in-depth conversation. And we've shifted to. I physically had to get out of physical practice because of my chronic injury. So I feel so blessed to be able to serve people still and change lives, even though I can't physically do the adjustments that I used to. You, out of necessity, because of your expertise in neurology and in blood work, it just makes much more sense for you to be working with people digitally, right? But the one-on-one thing slows us down. We can work with just so many people in a half an hour.
Right.
And an hour, so then we find our own bottlenecks here,
Right.
And so we've been really discussing ways to break that. You and I have worked on the same patients together. We've looked at their blood work and their heart rate variability and made huge lifestyle changes. But that's expensive for those one-on-one people. And like you said, 80% of what we do, and so a lot of the work that we do is explaining the basics when it comes to whether it's zone 2 training, whether it's heart rate variability, what's changing, some supplementation in their blood work. And a lot of it could be done in more of a group setting or even a community setting. So I'm very excited for what is to come with this digital conversation and how to serve people and make it available to a larger amount of people to work with us. Because if we create enough content and we create enough access within the community where they can sit with us one-on-one once a week in a group, we call it open office hours, having the ability to ask those questions to us like our one-on-one clients do will be incredibly valuable.
Let's just say an hour of my time is worth X amount. Let's just say $1,000, right? Okay, if that's the value that I put on it, you want to work with me one-on-one, now there's a bottleneck for you, right? But now if you're a member of my community and you have access to me 2 hours a month, every month of the year, you can ask whatever questions you want. And if we can't answer the question on that day, I'm going to get to that question at some point.
Or access through connecting community and answering emails and having access to the doctors.
Yeah, and in a virtual setting where you can give of your time to a larger number of people. First of all, people are going to ask questions that you want to ask. You can ask your question, and you can hear questions that maybe your friends and family members have, and you can be a resource for them. So having a community experience, yes, it's paid for, but a hell of a lot cheaper than it would be if you had me one-on-one.
And the things we address, you know, and they're all measurable. So
and if you wanted to work with me one-on-one, you certainly can. It's just get on the waiting list and buck up. Right?
Great. But if you're looking to change your lifestyle, so for example, a client of mine went to the chiropractor this week, and she's dysregulated for sure. And so through her history and our conversation, I was very well aware of it, and she was very well of her hypervigilance, how it's impacting many aspects of her health and her sanity, her ability to sleep, and she was really on edge. And I'm watching her, and she's hypervigilant, and I know when I'm working with a client that's reversible. Yeah, so I get excited because I know that we're going to
You know what they're about to experience.
Yeah. So in the process, we went through session 1, and the feedback was incredible. She was the person who swore she would never be able to do this, and then within minutes she was doing it, and she freaked out. So at the second visit, in between, I asked her to go to the chiropractor, get checked, get scanned. I didn't tell her who to go to, but luckily she went to a great chiropractor who used the same scanning that we have for years, and it literally showed one problem. Her atlas, her C1 vertebrae, red bar out to the right, she was subluxated right there. And for those that don't know what that means, that's the place where your brain runs everything, every cell, tissue, and organ in your body, run by your brain, nothing by Wi-Fi, right? So it's coming through this hard cord, the spinal cord, right, down your spine. And as the brain transitions to the spinal cord, it's the midbrain. And at the midbrain, very important for my work, autonomic nervous system, right? If you're dysregulated, that's where it's going to be. That's where blood pressure, respiration, heart rate, body temperature, anything that goes up or down in your body and regulates.
It's got to pass through that very
There's your thermostat, right? So that was out, right? And think of it. Was it out causing the problems? From my experience, no. It was out because of the problem. Right. Because of the dysregulation, that fuse, the main fuse in the body, was switched off and trying to manage brilliantly.
It's like in your house, you overload a circuit, the circuit breaks, in order to prevent the house from going on fire.
It's a brilliant short-term mechanism
Yeah.
to manage the crisis.
Right.
But left there, she was shut off. Snipers call that the off switch, right? We call it the on switch, right? So she gets her atlas adjusted. Now she's regulating her autonomic nervous system. By session 2, completely different person. Completely different person. And she's crying and can't believe it. This is the person who never, ever, ever can meditate. And then we don't meditate, but never can, in her mind, and I can never calm myself down. And I have all of these things going on with me, and all of a sudden they're gone.
Right.
That was done over a computer.
Right.
And for me, that's the good stuff. You know,
Yeah.
that's for me that makes the biggest difference. From somebody who walked away from being able to put my hands on people the way I used to and serve people, to be able to change people, to be able to be a part of people's lives change and watch it happen in front of me like we have for decades. Is this such a blessing again to be able to do that in a digital environment?
The practice of the future is going to be community based. You know, I think the virtual experience lends to this. You know, social media started as a place to kind of find your tribe, right? And so you'd kind of join Twitter, and then all the people who like to talk about whatever it is you're interested in were like, and that it started as a social construct. And then I think since TikTok came, it became more of a broadcasting medium rather than I think it's going to go back to, we're going to take the broadcasting medium of TikTok, Facebook, and Instagram and invite people into our experience, invite them into our world.
Well, I got something for you.
On a community.
AI's out there. You got ChatGPT. Why would you need you or I to talk to when you could just ask ChatGPT anything you want, and you're going to get probably 85% right with. I hate to tell you, if you go to most doctors, you're probably about the same percentage.
Yeah. So it's a great question, and I think AI being purely informational, that's going to be a place to get information about how things work, but to have a human experience. So it's kind of like it's kind of like taking 10,000 people, giving them a medication, and saying there's a statistically significant number of people who take this medication who will experience like their, I don't know, cholesterol dropping. And there's an overwhelming number of people who aren't going to experience the benefits of that. But statistically, so if we get 10,000 people to take the medication, you'll prevent several heart attacks in that group of 10,000. And then we say, all right, based on this study, it's a good idea to give people cholesterol medication. Now, you know how I feel about that. But people are not a collection of data collected by 10,000 people. People are individuals, right? So AI doesn't know you. AI doesn't know your history, your diet, your lifestyle. That 10,000 people in the study that AI is going to grab from, AI doesn't know that in our community, we have healthy user bias. We have people who are doing things that the 10,000 people were never even measured to do, like exercise and eating a certain way and you know, being a part of this experience. So I guess what I'm saying is AI will never have that one-on-one connection with you. And what we're saying about the virtual world is you can have a one-on-one connection because now I can teach a group of people how to identify the likelihood of them benefiting from a certain lifestyle change. So for example, there are some patients who I tell it's probably a good idea for you to go on a very high protein, high fat, low carbohydrate diet. And here are the reasons why you would do that. So now the person in the community can say, yeah, I fit into all those categories. I might benefit from doing that. Or here are the people who, and they're educated as who's not going to benefit from doing that. So they might say, all right, maybe a different strategy is better for me. AI is not going to be able to identify and have that connection, a human connection, where you and I have 30 years of experience working with patients, hearing all different kinds of histories and lifestyle changes that people go through and what we can expect. AI is just taking in a accumulation of data.
Yeah, it's not adding. It's also what we're able to do is put it in an organized way, shrink time for people, tell them what they could expect from a clinical perspective. I think that anybody can get information. Information is free these days.
It's free.
Packaging it in the
That's
right
not
way.
if anybody's charging you for information,
No, I mean it's great. I mean it's
Yeah.
a wonderful time to be in. But the thing is, it doesn't give you the whole picture. I'll go to ChatGPT to get information, GBT to get information. But when I talk to my doctor and I talk to people who have applied it in their life and they could expect, or what I could expect in the process and when I could expect, that's a different thing. So I think that's an important. And community is a whole other element, right? You want that connection with and confirmation with an expert. You want to say, I saw this. This is what I heard, and how would you go about it? And what have you seen in the past? So piecing together these lifestyle conversations, putting together content and packaging it well, right? So if you want to learn about Zone 2 training, you can probably get a whole lot of readouts on a ChatGPT. But if you want to learn how to really do it, we put together step by step.
and what should you expect from doing it, right? So a 25-year-old doing Zone 2 training, X number of hours a week, et cetera, et cetera, et cetera, who has this particular lifestyle is far different from the experience that the 55-year-old with type 2 diabetes is going to have. Right? And they are going to go about that experience very differently. So, AI will, again, from an informational standpoint, can provide you a ton of information, but it won't be able to help you narrow your focus and tie it to your goals and what your objectives are. There are people who think that if your goal is weight loss and your reason, if you say, all right, you want to lose weight, yes. Why do you want to lose weight? Well, I'm going to the beach this summer and I want to be able to take my shirt off and have a six-pack. Well, that's not necessarily a health issue.
Right. It's not a need. It's a want.
Right, exactly. But it's a want that's legitimate, and people should be able to get information on how to do that while staying healthy, right? To not harm themselves. Like, there's a lot of ways to lose weight. I could take a vacuum and do an incision in your abdomen and suck out all the fat, and you'll lose weight.
Right.
But you didn't become healthier.
And and in our community, we had an entire course designed on exactly the steps to do it. Then you could show up once a week to our open office hours and ask questions.
That's right.
To make sure that you're doing it right, or give us your feedback on what's been going on, what your wins are, what your struggles are, what your goals are, what have you tried to do yourself. So being able to have that, being able to create the content on how to do it within our community, so they have the steps, right? The steps are there. We've been doing it ourselves for years. We've been doing it with our one-on-one clients for years. So it's a great opportunity to create the steps for people so they have a course in each element. But what's even better is to interact with them throughout the week. They have the course. They're not going to ask the million details. They're going to say, should I stop eating at 8:30? When should I start eating? And this is what are some of the ways you deal with your cravings? And this is what happened to me, which is different because of the clinical setting, and you're different because you mentioned this is going on with you. So I think 90% of getting people's results.
And there's also the crowdsource. You're in my doctor's course for understanding blood chemistry, and every Wednesday night we do grand rounds and we go over cases. And when we first all met, it was kind of like me being the teacher.
You did all the talking,
yeah.
right.
And now every week it's like a conversation, and everyone is sharing, and the learning experience is far more accelerated because there's people in the room with the same interest having their experiences and sharing them. So this holds true for, it's nothing better than having an online community where somebody has a question and it's answered by somebody else in the community, and then you just kind of guide that conversation. It's awesome.
So this is definitely, it's a new world for health care. Health care, we'll call health care, because this is taking care of your health. It is a new world where people have access they have access to everything. I think it could be a little bit chaotic and confusing to have that sort of access and not know what to do with it.
Right.
Being able to have an option to navigate that is key. That's what we do with our one-on-one clients. It's expensive and it's expensive because it's limiting. I mean, how many people could you see in a day? You know, you can't. When we were in practice, I used to see 100 in one day. I can't see that virtually. It's
That's
a
right.
30-minute to 45-minute conversation.
And if you're seeing 100 in one day, okay, you know, you're gonna the economics of that is gonna dictate your lifestyle, your mortgage payment, you're sending your kids to college, you're feeding your family, your vacations. Well, if I go from 100 people in one day down to 5 people in one day, I'm not gonna have my lifestyle go down 95%.
Right. So
that's not
the
gonna
fee
happen.
goes up.
The fee goes up.
So now we've tapped into the idea of creating community and speaking to people where they have access to all of our brain content and everything they need to do, as well as the ability to ask us questions at different aspects throughout the week when we have those live calls, and we're able to bring that price back down, even probably lower than they would come in once a week for an adjustment. You know, the monthly fee, it probably costs about as much as one adjustment for the month, as opposed to, say, coming in once a week. So I love that because, you know, for me, it's about results. It's about being able to do what we've been doing our entire life and affecting many people. You know, I don't want to affect 10 people in a day. I don't even want to affect 100 people in a day. And we want to get this out to this is what people need to know to make the changes we're navigating their podcasts that they're watching, whether it's, I mean, I love watching Andrew and I love watching Peter's podcast. I love getting that information, but what are you going to do with it? Right. And you're kind of left to your own devices at that point, and you're on your own. They're not clinicians, right? So now to be able to have a clinician who created the content, who's it's their intellectual property. They used it themselves to get results with many clients, and now it's available for them, and we're also available to answer questions to make sure they can navigate that to get the best results.
You know, it's interesting, the decisions that we make and the conversations we have. So at the time of this recording, a big thing in the news over the last month has been about Tylenol, right? And the role that Tylenol may or may not play in autism. And it just goes to where so much of our studies and our efforts go to. The idea is there's a question: does taking this medication result in brain-based childhood developmental challenges? And there's good reason to believe that it might. And then if you go through the data, you can find all kinds of things wrong with the studies that they're citing. And then it's like, you know what? Let's just break through the noise here. If something is poisonous, taking a little bit of it is just less poisonous, right? So if it's going to poison you at a high dose, it's poisoning you less so. And then the question is, if I take 10,000 people, give them Tylenol, and how many babies are there, and does the rate of autism go up? All right, those are all good questions to ask. That's not the world that I want to live in. I don't want people. I would rather people not have to take Tylenol when they're pregnant. Like, that's the fact that we're asking the question raises all kinds of alarm bells for me, and the mechanism of action according to the basic science of why that could be so we all know, you know, in the science world, we've known for over a decade that Tylenol reduces the production of an important molecule called glutathione. All right, we need glutathione. It's super important. It's probably the most powerful molecule your body makes. Why would you want to interfere with that, right? There's going to be a consequence to that. So right out of the gate, it's like, I would rather spend my time educating people about what to do to never have to take the Tylenol than to, you know, worry about the risk of taking it, right? There's a risk to everything pharmaceutical. If it doesn't have side effects, it's not a drug. End of story. Eli Lilly said that himself. So no matter what the medication is, there is risk. All right, so let's take as little risk as possible. I think that's a good idea. I don't want to waste my time as a podcaster or as somebody leading a community, you know, for patients or even for doctors to parse through this data. Like, to me, that's just not interesting. It's actually boring. I want to strategize preventing people from having symptoms and getting sick. And that's exciting because you can use basic science and you can say, look, you make these lifestyle changes. If they work for you, we'll measure them. If they don't work for you, we'll pivot to something else.
Right.
You're not gonna 3 months of changing your diet isn't gonna result in some kind of horrible experience for you, right? As a matter of fact, when I do make recommendations and I say do this for 3 months, I also say that if you're not noticing something improving in the first month, well, maybe it's not going to work, right? So it's not like you're taking risk, whereas with medication, you're taking risk, right?
Right, and what we're talking about is pretty solid. The problem, I think, what we're talking about is lifestyle change.
Yeah.
Our issue is lifestyle change. Our issue is not whether or not we get results. Right. And the issue is whether somebody wants to change their lifestyle. Right. And it does. That's the biggest shift. But when they do, and they engage in the pillars that we work them through lifestyle, they get results. So there's no doubt in our mind when it comes to zone 2 cardio and VO2 max that is the most effective and efficient way to go about it. There's no doubt about the way you analyze blood work from a physiological perspective, looking for interference in their function of their body and correcting it, that's not working. There's no doubt in that. There's no doubt in heart rate variability and measuring autonomic tone, right, and measuring it back. There's no doubt in functional, movement assessment, realizing where your limitations are. You have to just overcome them. So we're bringing people through the pillars that will change their life. Our biggest issue is not whether it works or not, if there's a side effect. We know it works. It's making sure they have the information and that they're confident to make the changes and choices, and that they have the will to do it.
And they know what. I'm glad we went down in this direction, because whenever I'm in a room with people who are medical doctors and in the primary care physician world especially, but really any kind of medical doctor, where you ask the question, why don't you do more with your patients on lifestyle change? The answer is always the cynical answer, like, people don't change. We give them drugs because we know they're not going to change.
They're never going to do.
They're never going to do what is necessary.
Right.
What you do, my patients aren't going to do, is kind of the
But
the
aren't
mantra.
they, in fact, making that decision for you by not even offering?
Yeah.
it to you?
Yes. But actually, again, they're not wrong.
or they
They're
don't
not
have it
wrong.
to offer anyway.
But the people who are going to join our community, they've already made that choice. So we have people who are like, no, I want to do this.
They're already trying
And
to
I'm
do it.
joining your community so I don't waste time and money doing
We're gonna
things
shrink
that don't work.
time.
We're going to shrink time.
Get
We're
results
gonna
fast.
Correct. And that, from
3 months is a long time 3 months is a long time working with us.
yeah.
There's no way you're not getting a result by then, and that's the longest you're going to go, right? That's our blood work window. I mean, heart rate variability. We're seeing difference in weeks. We're talking about within a week, 90 seconds in some cases. So there's when done properly, we're going to see a result.
Right.
It's knowing what, knowing when,
And
knowing
then
how.
incentivizing and inspiring people to make changes that are long lasting. So, for example, let's just say you can, in 3 to 6 months, you can reverse type 2 diabetes, which we know is true and have seen it a million times. Okay, well, once you have that, 6 months go by, do you go back to the way things were? All right, go ahead, go back to the way things were. Trust me, you'll go back to the way things were. Your type 2 diabetes is going to come back.
If you go back to things they're going to go back to exactly the way they were.
Exactly.
You've already proven that to yourself.
And then now that you're doing so much better, of the changes that we made, which ones of them are you not able to continue with? And we need to strategize, well, what the hell does that look like?
And if they've made it that far,
They
can. But let's face
course.
it. But you're helping people make choices. But interesting point, because the medical doctor would say they're never going to do that, right?
Right.
Once they do that and have some sort of a result, they get hope.
Yeah.
And then they do more of it.
Yeah.
So you know what? Having a little bit of hope and understanding human beings from the perspective that we are, people are motivated because they're having negative results.
Yeah.
People are motivated by how they feel. If they feel like crap, they'll do something to change. They'll stick with it if they feel a lot better, and if they don't feel a lot better, they'll go back to the way before. Right. So it's just a matter of getting some sort of results from the beginning and getting that little bit of hope. And you know what? The journey of 1,000 steps starts with step number 1.
Yeah, look, if you're a doctor out there and you're thinking about getting more involved in the virtual world, listen to this podcast again, because it is very valuable. And again, especially those who are, so I know a lot of chiropractors who love functional health and functional medicine, and they want to do more of it. And they're like, all right, yeah, Monday, Wednesday, and Friday, I'll wear my chiropractic hat. And then Tuesday and Thursday, I'll wear my functional health hat. That doesn't work, because it's going to cause burnout.
Well, when they come in for the functional assessment, they're going to want to get adjusted. They'll come back tomorrow.
Right. And when they come in to get adjusted, they want to ask you a question about the functional health.
Exactly.
So separating it into here's what we do in the office and here's what we do virtually is a great strategy. And then utilize the tools that are out there. Remote patient monitoring is awesome, where you can get their sleep data, you can get their, just have an efficient way of looking at the data, tracking it, and making recommendations based on it. That takes a little bit of work. But once you have a system, then you can build your community and democratize the cost, right? And democratizing the cost means creating a community where people are paying for your time collectively, so you're going to maintain your lifestyle as a doctor and your value, and they can afford.
You can make it at an affordable price. Right. And you're still serving, and you're serving honestly, I think, on a higher level.
Correct.
When you separate the two, you can be more effective.
And for patients looking for where should they go, find the doctor in the community that resonates with you and your health challenges. There are communities that are based on mental health. There are communities that are based on metabolic health. There are communities based on improved performance in physical fitness. There are different communities led by people like us.
And look for ours, because based on working with our one-on-one clients over the years, we've created a system that people can engage in, and they can get those same results of our high-ticket clients at a much lower version, and also have access to us. So look for that, because we want to be able to serve those people.
And
as well.
We are not AI generated.
No.
We are real. We will shrink time. If you ask a great question to ChatGPT, you better have the time to go through everything that it gives you, and then even then. So again, how valuable is your time? Know that this is our profession. This is what we have experience with. We ask questions of AI in a way that you probably wouldn't, and therefore we can collate that data and give you a strategy so you don't have to spend months trying to figure it out.
Right, and we've pretty much locked down some pretty solid pillars on changing your lifestyle, so you don't have to go through all the turmoil of trying to create it yourself. It's tried and true. We do it ourselves, and we've been using it clinically for years.
So I take my mom to her doctor's appointments, and my mom is 87 years old. So I took her to a doctor's appointment this past week. It was a routine appointment, but all right, I got to go pick her up. She's got to get ready. I mean, this is like the appointment is 7 minutes. I got to go. I have to stop my day, go pick her up. I pick her up. She's got to get dressed and ready, and she walks real slow with her cane, and we go to the doctor's office, and you have to go and give your card and make your co-payment and verify a whole bunch of stuff, and you sit in the waiting room, and then they call you, and then that's 5 or 6 minute experience is taking 2.5 hours out of my day and my mother's day. Wouldn't it be great if she could just flip her laptop open and have the experience right there? She don't have to get dressed. She don't have to do anything.
Right.
And have that experience. And I could be there from my office. I could be there for that whole 6 minute appointment with my mom, asking the doctor the questions that I need to ask.
Or how many times do you go to the doctor and he's in and out in 30 seconds?
Oh,
And but when you sit with a doctor virtually, they kind of have a good 10,
yeah.
15 minutes. Any other questions? Like you're sitting across. It's a very different vibe, and I think it's a comfortable place. And you don't have dot white coat syndrome as much.
When that appointment is at 4 p.m., we get on the Zoom call at 4 p.m. exactly every time. And even if I'm finishing up some notes on my previous patient or whatever, they're there. And I'm like, Mrs. Jones, I'm going to put you on mute. Give me a second, and I'm going to finish up what I'm working on. And at most, they're waiting 2 or 3 minutes for me to show up. The appointment's at 4 o'clock. They flip their computer open at 3:59. If I'm not on at 4, I'm on at like 4:02, right? And then if the appointment is quick, at 4:15, they're getting on with their chores and their day and their laundry and their shopping and all that stuff. And
15 minutes with a doctor is a long time.
It's a long time.
It's longer than you're getting when you go to that 2-hour
Right.
ordeal.
And sometimes...
And they're always in a rush to get into the next room. So now you got them, you have your notes down before the meeting, and you can have that consultation like a business meeting.
This is so efficient that I actually do my discovery calls where, my time is very valuable. But there are some patients that are referred to me that don't know what I do. And I don't like for people to pay for something if they don't even know what it is. So I like to not charge for the discovery call. I want to make sure that I'm the right person for them. So
Right.
I'll ask those questions. But it's so efficient. It's not, again, yes, it's technically free, but I don't want to waste my time or their money or their time if I can't help them. So I at least can steer them in the right direction if they don't become my patient. It's worth it for me to do that because it doesn't take much.
And regardless of whether they work with you or not, patients get a lot of value out of that time. So I think that's an important call to have with people who do the same thing. And I tell them that it's not a sale because, online and digital, not sure if it's somebody's selling something. I say it's a free call. It's how I want to find out what's going on with you. It's all about you.
Right.
Let's discover what's happening with you. I might be able to help with what I do. I might not be able to. Let's find out in that call.
Let's find out if I'm going to be the best person for you.
But I think you'll get a lot of value out of that call, and that's why I encourage them to go. And if they are a fit to work with me, that's a second call.
Yep.
I make a second time for that, and because from
and
that
then they
call,
know what the fees are. They're well aware of what the experience is going to be.
and you can kind of customize it. It's not the same thing for everybody. After that, they're telling you what they need.
Yeah.
So hopefully you can help them or not. If you can, then you create an ideal situation, and you offer that to them on the next call, and it's a nice way to go about meeting people and having those conversations. I learn a lot about what I need to know from those free discovery calls with those potential clients.
The freedom that we have, because for the last 15 years I've been not involved in insurance claims or anything like that. Like there's no third party not in the room.
Right.
Trying to figure out
Whether they're going to pay you or not.
Right. So this is a one-on-one relationship. If the value is there, it's there. And whatever your fees are, if you see the value, you'll take the next step. An extraordinary fee for an affordable service is kind of like my mantra, right? That doesn't mean it's not expensive. It's probably going to sting a little bit. But an extraordinary service for an affordable fee is a good, and then creating an environment where people can join a community and get the benefit at a much cheaper rate.
Yep. I've been your client before we worked together with my kids. You identified the problem. As a parent, it was invaluable.
Yeah.
So the money you spent on the blood work and the reading and the advice and the conversations you had with my kids to change their lifestyle was invaluable and nowhere near an exorbitant amount of money,
Right.
especially for the results that we got. So I think it's just to encourage people to make those calls and ask those questions, ask a lot of questions. So all right, so going forward, why would somebody want to listen to what we're talking about here, Steve? We come here every week and we're talking about healthcare and making changes.
If you made it to this part of the podcast, then I think that question's been answered, right? Experience, efficiency, community, holistic approach that involves not just blood chemistry and x-rays and history, but also the mental, emotional, and spiritual side of healing and what that process is like. I think just putting all that together and compressing time for people is so valuable.
A place to go, a
Yeah.
place of community. People ask questions and
Yeah.
feel confident. And that they're making
This is the
right
future.
choices.
The future is identifying your community.
Right.
Right. And again, Facebook started that, right? You know, the Facebook groups for Parkinson's and the Facebook groups for, you know, people who have Parkinson's who play the violin who are female, right? Like that, you could niche down into your community, and you know, there's great value there because it takes you out of that group of 10,000 faceless people who've been studied on, you know, single intervention. Does this medication lower your cholesterol, and does that yield fewer heart attacks for you?
And in a world where we've been socially distanced, and people, you can go to a medical office and people are wearing masks behind the glass.
Yeah.
I think community is finding the right. That might be your community,
Right.
But if that's not your community, and your community is one of asking questions, seeking knowledge, wanting to make the right choices, and knowing the latest information on how to get healthy, in a community of people who are also doing it, those are the people that are probably going to be looking us up.
100%.
So, all right. Well, thanks for the great conversation again this week, Doc, and
Great
see you
stuff.
next week, right?